Welcome to Phlebology's Meet the Authors. I'm Sherry Scoville, and I'm here today with Stephen J. Smith, who is an MD, an interventional radiologist. And he's always had some interest in pelvic venous disease, and over the years, he's become quite the expert. We'll be talking about his paper today entitled Improvement in Chronic Pelvic Pain, Orthostatic Intolerance, and Interstitial Cystitis Symptoms after treatment of pelvic venous insufficiency. And actually, this paper has been listed in the top 10 POTS syndromes papers in the world. Congratulations, Dr. Smith, and we're so happy to have you here with us today.
Thank you very much, Dr. Scoville. Thanks. Well, that is weird that some sort of interventional radiologist paper ends up making waves in some other field of medicine. But what we're finding out is that everything is connected through blood flow and blood return. And so this is a kind of fascinating thing that we've stumbled on.
So tell us a little bit about how you did stumble upon this. How did you notice the association between this venous origin chronic pelvic pain and some of these other disorders?
Sure. Well, I don't know, several years ago, I noticed that one of my patients told me that after the procedure, which we'd done to fix sex pain and pelvic pain, vagina pain, that something completely different that she hadn't even told us about was cured. And so we didn't set out to do it. And that was interstitial cystitis. And it turned out she also had POTS syndrome. And that went away. So that was pretty interesting. And she didn't tell us about this other stuff because patients have this idea, I'm going to see this specialist for this problem, then I'm going to go see that specialist for that problem. But then another patient had it, and then I had really stumbled into a whole world of interconnected blood flow conditions that I was never trained much about, except in medical school.
And you did a survey on your patients as well?
Yeah. I worked with the Pelvic Congestion Support Group, which is an online Facebook group of 7,000 women all over mostly the English-speaking world. And I made a survey of symptoms of syndromes that are all interconnected with POTS syndrome and interstitial cystitis, and there are a bunch of them. Irritable bowel syndrome, migraine, fibromyalgia, chronic fatigue syndrome, a lot of different things. And so we gave it to people on this Facebook group who were there just for pelvic pain and pelvic congestion syndrome. And so what happened was we found out that these patients were dysautonomia patients. They were POTS patients. They had a bunch of other comorbid conditions, and we published that paper of 400 respondents. So then I decided to make a sort of an omnibus questionnaire and give it to our own pelvic vein pain patients to see if any of these many interrelated conditions were present in our pelvic vein patients. So that's what happened. And that started, I don't know, maybe 2016. And a lot more is coming out.
Very interesting. And can you tell us a little bit more about the International Pelvic Pain Society symptom score and the novel questionnaire that you created and used?
Well, so what I saw the problem as very complicated. So I think I'm noticing that patients have all these different conditions that are being cared for by other specialists. Why would anyone believe me, an interventional radiologist, saying that I am finding out something special? So I just took some sort of canned surveys from different specialties and put them in this omnibus questionnaire and gave them to our patients, so that if doctors from other specialties could read the results, they would have some grounding in them. They could say, oh, yeah, okay, I know that. I know about that. Because it sounds crazy that all this stuff could be linked.
Can you talk a little bit about the interplay between these complex entities, or why are they and how are they related?
Yeah, it's pretty fascinating in my opinion. And so basically when we stand up, one of our authors, by the way, is an anthropologist. When we evolved to stand up, a lot of things have to happen for us to be able to function, and we don't think about them. And the autonomic nervous system is involved, and so it has been indicted, it has been blamed for people having a lot of these problems. But you need to get blood flow up to your brain when you stand up. People with long COVID have problems. People with chronic fatigue, migraines, brain fog, POTS syndrome. So everyone has thought that there's just something diffusely wrong with your veins. And so when you stand up, the lower body veins just kind of bag out. And then that's responsible for, people passing out, dizziness, all these other chronic problems. And then there's a domino effect to other related things. But it turns out that, like I said, irritable bowel syndrome, chronic fatigue syndrome, interstitial cystitis, brain fog, migraines, on and on, are all occurring in the same patients, and they overlap 70%, 50%. It doesn't make sense that all of these things have separate occult causes. There must be something is causing multiple things. So that's what occurred to me.
That's amazing. And can you take it one step forward and tell me a little bit why many patients improved, but there were some patients where some of these other entities didn't necessarily improve?
Yeah. Well, I'm not saying that I've discovered the panacea for all this stuff. That would be, I start out with patients who have vein problems, and I'm noticing that they have got all this other stuff. Now, the whole rest of the world thinks that chronic fatigue syndrome or whatever is caused by bad nerves. And we know that there can be immune damage to autonomic nerves. You can have viruses like COVID or Epstein-Barr virus mess with your autonomic nervous system. There's a lot of non-vein things that can go wrong. It's not surprising that not everybody would get better from this stuff by fixing their veins. What's surprising is that a lot of them get a lot better. So veins haven't been in the discussion in the wider world of these other specialists, okay? And I say it's like there's an invisible elephant in the room. All these papers are like, well, we don't know what causes this, and it's a mystery, and we think it's the mitochondria. So they're beating the bushes, but I'm just hoping we've stumbled upon something that can help these patients out of the woods.
Wonderful. And what are your next steps? What can we expect from you as we move forward?
Well, let's see. There's another paper submitted to Phlebology that I have to get them to accept, which is about individual ICD-10 symptoms. There's a larger 100 patient followed for 1 year study of the same questionnaire coming out of Mayo Clinic. And then we need to do it. We have a protocol for a prospective dysautonomia lab tilt table trial where we can take these patients, test them extensively before and after fixing their veins, and then see if physiologically, demonstrably, we have actually fixed some of these problems. That takes the placebo effect out of it. So if there's anybody out there, we need some money. And I think this is a huge, interesting avenue for future research.
Wonderful. We really look forward to the results of those studies. And thank you so much for your time and for your willingness to discuss your paper with us. We really appreciate it.
Thanks very much. Thanks for having me.
Bye-bye.